Welcome back to the Wellness Script podcast, your source of truth for all things health and wellness. My name is Lauren O'Reilly and I'm a qualified pharmacist and your host for today. Today, I'm really excited to be joined by Professor Afif El-Khuffash, consultant neonatologist at the Rotunda, Professor of Paediatrics at RCSI, lactation consultant, digital artist, and co-host of the Baby Tribe podcast, as well as a comedian. Afif has built an extraordinary career in paediatrics and newborn care with over 180 peer-reviewed publications and more than 20 years' experience caring for babies and for families, often at their most vulnerable moments. Today, we're starting with the person behind the profession. So, what wellness looks like in such an emotionally demanding field before moving on to early parenthood and what to expect there, breastfeeding, colic, reflux, misinformation online, and the pressure that is placed on mothers and fathers. I hope that you really enjoy this episode. I loved this conversation with Afif. Afif, you are very welcome to the Wellness Script podcast.
Thank you so much. I am so happy to be here.
Thanks so much for joining me. I've been listening to the Baby Tribe podcast. I'm not a parent, but I just find you and Anne so engaging, like an infectious. I just get so much out of the conversation and bring it into pharmacy and conversations and
yeah. Well, I'm delighted to hear that because I was just having a think about our core audience actually this morning, and the majority of our listeners are women.
Yeah.
And I always wonder, are there non-parents, that aren't pregnant even?
Yeah.
Do they listen to us as well? Or is it of interest to them? Because we're always thinking of how can we get more people to be interested? Because a lot of the stuff that we talk about doesn't only apply to parents sometimes. Yeah. It can apply to various other situations. So great to hear that you're an active listener. So thank you.
Of course. Yeah. No. And you've covered everything from even life coaching and, people who have gone on different journeys. And I think Emma Kyo was one of the ones that I listened to a little while back. And I just find your experience, both of your experience in life and the amount of training that you've done and your parents, obviously yourselves. And it's just, you bring a lot of wealth of experience to the topic that you're discussing, that I feel like I just kind of absorb a lot of the perspectives that you bring. And when I read about you, Afif, like you're so qualified and so busy in your space and in your profession. Like, I think about wellness for you from a personal perspective. Like, what's that look like now in your life?
A great question. Wellness to me changes, I guess, based on situations. And I recognize that, a lot of our listeners, and maybe some of your listeners, may have young kids or babies, and they were like, I have no time for wellness. And I think it's important to recognize that is okay.
Yeah.
Because I remember when we had our kids, they were very young. I had no time to do anything but work and keep them alive.
Yes.
With obviously, and the bulk of the keeping them alive work. In fact, she never fails to remind me of, there was one time where she just went back to work and was doing a 24-hour shift, and Maggie was only maybe 15 months old, and she calls me to see how are things going. It's, oh, great. But you know what? She's very fussy. She won't go down. She won't sleep. And she's just like being grumpy with me and shouting at me and stuff like that. And she was like, oh, what did she have for dinner? And I was like, I'll call you back. I just forgot to feed her dinner.
Oh, God.
And that's why she was angry with me.
She's like, so confused. What's wrong with this child?
I'm so confused. Exactly.
And you a neonatologist.
I know. I'm not really painting myself in glory here. And I only began to look after myself a bit more when I had more breathing space. And my kids were a bit older. And it's only over the last 5-6 years, to be honest with you.
Yeah.
So started going to the gym again. We have a dog. So going out for walks at the weekend is something I really look forward to.
Yeah.
And I like having time for myself in the evening. So I actually game. I'm an avid gamer. I love playing video games, and I get really engrossed in the story. And to me, that's a lovely way to just sort of, detach from reality, I guess, and then just get engrossed in a story that you can contribute to over a while. These are the things. And again, there are times where life takes over, and I don't worry anymore about not being able to fulfill some of those things, knowing that, these things come around back eventually.
Yeah, that's so true. And I think that's interesting because like on this podcast we're talking about wellness all the time, and I am always conscious of the fact that people are looking at it through different lenses and different stages and phases of life, and that if we're talking about, say, sleep, for example, and we're saying, like, oh, sleep's so important, and when we don't get sleep we feel this way, or it affects our health, and also that on the flip side of that can actually cause like health anxiety and like stress for people who are in a phase where they have a small baby, or they have they're just in a phase of life where that's just not possible for them.
And I'm glad you brought up sleep, because it's the one thing that you keep hearing almost all the time, that it is the one thing that you need to work on and optimize in your life, right? And as a parent with young kids, for example, or even if you don't have kids, if you are a busy person, you have a lot going on in life, sleep is one of the first things that can suffer, right? And I always worry that people put an overemphasis on sleep. And if you don't achieve your 8 hours, who does 8 hours anymore? Like, honestly,
not me.
I can't remember the last time I slept for 8 hours. And even now I wake up maybe once in the middle of the night, for, various reasons. And then sometimes I can't fall back asleep. And I find myself going, gosh, if I don't sleep now, I won't get my at least 6 hours. And then you end up worrying about it. Everything, I think, fits in a little puzzle of things. So if sleep isn't optimized, there are other things that you can do. And it's doing things in little chunks. But even like closing your eyes and resting for 10 minutes, even without falling asleep, can be restorative, So recognizing that you will not be able to achieve all of the pillars of health all at the same time, and just accept that.
And that makes me think kind of even your work, like you're obviously treating the baby, but you're kind of treating the parents as well. Is there a psychological kind of element?
Hugely, because interestingly, when I first started neonatology, I was like, great, my patients don't talk back, so I can just...
I wouldn't mind that, actually.
I can just get on with my job. But you forget that, 90% of what you do is communicating with parents, right? And
worried parents.
Parents in very vulnerable situations, parents that have had their lives turned upside down, and parents that you will build a big relationship with, because some of our babies stay with us for months, right? If a baby's born at 23, 24 weeks, you're looking after that family for 3-4 months, and you end up knowing them quite well. So yes, communication is a huge thing. I often find the actual medical piece is the easy bit, but the communication, being in the moment and being mindful, trying to figure out what the parents aren't saying to you can be challenging sometimes,
You're trying to read what's going on. Is that kind of coming from, like, is there a huge guilt with new parents? Not guilt, but maybe the pressure, like, of entering this, and kind of feeling like they've not done something right and it's their fault, or I don't know. Is that kind of
guilt is a huge thing, and I think it overwhelmingly affects mothers, because they're people carrying the baby, and they often blame themselves for things going wrong. And a lot of the time we cannot pinpoint as to why a baby was born premature, or unfortunately something around the delivery happened that has led to the baby becoming extremely unwell at birth. But of course, moms are going to blame themselves, and they're going to think back to every little thing that they may or may not have done that may have led to this. And my job a lot of the time is to reassure moms that nothing they could have done or not done would have led to those situations, So guilt is a huge thing.
One of the things I see all the time in the pharmacy is parents standing in the aisle trying to find something for a baby with a blocked nose or a toddler with a cough, and the options for the really little ones are surprisingly limited. So when something gentle and effective comes along, I think it's definitely worth knowing about. Otazan's range is something I genuinely recommend keeping in the family medicine cabinet year-round. From their baby nasal spray and the Fortus cough syrup, both suitable from 1 year old, to the nasal wash, which can be used from ages 6 and up, the whole range is natural and family friendly. From seasonal sniffles to coughs to ear care, it's a full family wellness range from Otazan, an Italian natural wellness brand that's been around for over 30 years. They are ear, nose and throat specialists that combine traditional herbal knowledge with modern research. And today their products are used and trusted in more than 30 countries around the world. And you'll find them in pharmacies and health stores nationwide. Yeah, and I suppose hearing that kind of reassurance from you, the neonatologist, comes like has a lot of weight. So I'm sure that's really helpful.
Yeah, sometimes it does, and sometimes it doesn't,
Mm-hmm.
and it's also acknowledging that, look, it is sometimes, acknowledging and being able to sit with that feeling. And trying to rationally say, look, this is nothing that you would have done, but look, I understand that as a mother, you're going to feel like that. And it may take time for it to slowly change. You can't sit down and say, oh, don't be silly, it's not you. Do you know what I mean? You wouldn't say that in that way, but sometimes we may just dismiss that guilt very quickly rather than acknowledging that, look, we may have to sit with this guilt and slowly work through it. And that sometimes is better than trying to, dismiss it straight away. Like, of course, you say, I honestly do not believe that, anything you have done or not done. Sometimes they focus on something specific. I went for a run, or I was on a bike and I fell off, or I slipped, or something like that, and it can be hard to remove the focus from that. Yes, I can see. Because it's the only thing that you feel is we focus on what we can control or what we could have controlled maybe. And that can kind of become the focus. And I'd imagine that extends then into like breastfeeding and things like that. I know that that's something that that you work on and you talk about. And I love how you talk about the breastfeeding dyad, like the explain that to me, because I think that's so well. I think that the term dyad, it describes the mother and baby unit when it comes to breastfeeding, but I like to use it outside of the breastfeeding I guess conversation as well, because the relationship between mom and baby is not really determined or led by how you feed your baby. So the dyad basically is the mother and baby unit. And the term was, I guess, used to recognize that you're not just looking after the mother or looking after the baby, you're looking after both of them as a unit, especially during the first few days or few weeks after delivery, because mom and baby can be quite vulnerable and they both have a lot to learn from each other, especially with new parents. You're becoming a parent for the first time. The baby's getting used to life outside the womb. And that's where that term comes from. And the way I approach it is absolutely acknowledging that breastfeeding has so many advantages. Breast milk is such a magic liquid.
It is, isn't it?
When you really think about it. And it can give babies the best start in life. However, if you choose not to, or if you can't, or if you're combining with formula, that doesn't mean that your baby is destined to a disadvantaged life, which is sometimes the narrative can make people think that is the case, And we talk about the pillars of health for an adult. A baby, yes, needs to be fed, and preferably with breast milk. However, if that is done at the expense of mom's mental health, then that baby is not going to be in a favorable environment. That's true. And sometimes it may be better to acknowledge that formula needs to be used in order for mom to have a rest, or not stress too much about providing for the baby in terms of the volume of milk in a 24-hour period. I mean, I come across mums that are putting the baby to the breast and then pumping to express and then topping them up with supplemented breast milk in a bottle. And they just do the cycle over and over again because they are terrified of giving formula,
Okay.
you know.
Yeah.
And sometimes all they need is the acknowledgement that they are doing an incredible job and topping up with formula in order for them to have time for themselves and reduce the amount of stress is what is needed. And sometimes the milk supply goes up when mom actually relaxes a little bit, you know?
Yeah. So it's not just like, it's not just that it's available as an option. In fact, it might be better for both mum and baby and supply and everything else that comes with that.
Absolutely, yeah.
Yeah. And do you think in Ireland it's particularly challenging with regards to breastfeeding? Is there a lot of resistance to it now that you see, or no?
No, I don't think there's a resistance to it. Most first time mums want to breastfeed.
Okay. Yeah.
And I think where I think we get the challenge and the issue is the support.
Okay. Yeah.
So we don't support mums well after delivering baby. And again, the supports in the community aren't ideal.
Okay.
So we have real challenges with having enough midwives to look after, you know, the mother and baby dyad. So, and this is universal, not particularly in any particular hospital, but you often have a midwife looking after sometimes 6, 7, 8, 9 mother and baby pairs. How are they going to spend enough time to support a mother breastfeeding? Well, I'll give you the contrast. So we had our daughter in Ireland and our son, we had him in Canada. And the difference in staffing and the community support was night and day.
Serious. Okay.
Yeah, we had one midwife that looked after us and another couple. That was it.
Wow.
That was her job. So she had so much time to help with the latching. We had lactation consultants at hand. We also were offered daily visits back to the lactation services until our son basically established feeding.
Wow.
You know?
Oh my God. Just as part of that standard care.
Standard care.
Okay.
And, you know, and Canada is a universal healthcare system. So it's all part of the standard care.
Okay.
Whereas we didn't get that here. And a lot of parents won't. And that's, I think, one of our biggest issues that we need to work on.
Yeah. Because it affects obviously every part of the mother and baby journey, but also, like maternal mental health, as you said, like and then if baby's not latching, again, the blame and the guilt kind of piece is there. But if you had enough support and more support, then it'd be much easier.
Yeah.
And I think like as a consultant, you're also trained in lactation specifically, but that's very unique, isn't it? Like that you've gone to that kind of level.
It's not something that we get in medicine or even in pediatric training. In fact, we got almost no teaching on breastfeeding. We were just told breastfeeding is good, but we weren't told how to support women or mothers to breastfeed. So, and I found that was a big knowledge gap that I had coming back from our training in Canada. And I felt that in order for me to adequately support mothers with their feeding choices, irrespective of whether it's formula, breast milk, or combination, that becoming a board certified lactation consultant was actually really important to do, because it actually helped me also better understand formula feeding and how to support mums with formula feeding. So and I think it's one of the best things I've done in terms of my medical career. I think that it's so like it's so individual in terms of in Ireland in particular with healthcare professionals as to the interest that they take in a particular area, whether that's a GP who's interested in women's health, for example, and I'm just going to a GP in my area, and let's say it's about contraception or it's about periods or endometriosis, PCOS, or something, and the care that I get is so dependent upon a particular interest that person may or may not have. Yes.
Whereas, like, I'd love if it were more standardized, that you knew, okay, if I go to this person, they'll definitely understand the issue that I'm going to have. Or that there's some kind of special pathway. Whereas I feel like, especially I see it for women with regards to, say, periods and endometriosis and PCOS and things like that, that the standard of care that they get is so variant on just like that somebody took an interest or didn't particularly take an interest in that area of healthcare. So, and even
knowing how to access that person can be sometimes a challenge. And I know there's been a big move now to recognizing that, as a GP, you can't know everything.
No, of course
But
not.
what a GP needs to know is how to direct
Yes.
to,
Mm-hmm.
the relevant people. And I think that is slowly happening.
Yeah.
So GPs may not necessarily be experts in women's health, PCOS, endometriosis, but they should be able to screen for symptoms that may point towards something,
Yes.
and then know how to refer.
Yeah.
And I know there's a lot of work happening, especially with endometriosis,
Okay.
to inform GPs of screening.
Yes.
The problem with endometriosis, and I only know this from having experts on the podcast, is that the symptoms can be very difficult to actually pinpoint.
Yeah, and so different from person to person.
Exactly.
Yeah, or even silent sometimes. So yeah, I think that it's the pathway thing, and the not getting, I suppose, the getting sent back or just on a hormonal contraceptive or whatever it might be, just to mask a symptom rather than actually getting treated, because naturally that will affect, well, your health and well-being, but also if you try to conceive later in life and you didn't know. How much of that do you kind of come across in your work, Afif, in terms of like the mother's journey with her reproductive health, and maybe she's had one child but is thinking about the next? Do you see like the planning stage, like as in, okay, I have PCOS or have endo, I need to try for another child soon, or that
so
kind of
I don't in my professional career, no, because I am strictly babies.
Yes.
But obviously that happens in parallel, around me. So
Around you,
and again, it's a completely different specialty. So antenatal care, pregnancy, conceiving, and all of that is dealt with our obstetric and gynecological colleagues.
Yeah. It's all kind of, there's so much being covered within your wing of the hospital. But going back to kind of the early parenthood kind of piece, and what people can expect and the kind of guilt around that. Like, are there things that you wish that parents knew before they went on this journey?
So one of the biggest things I always advise parents to do is to try and not compare themselves to other parents, and avoid what Anne calls the birthing and parenting Olympics. So
that's a good term.
It is, because especially with social media, you will compare yourself to other people, and you will think that you're doing something wrong, or there's something wrong with your baby. And there's so much variation in what is normal, that we need to, number one, acknowledge that, and number two, accept that your situation is unique to you, and you shouldn't be looking outwards. You should kind of look inwards. It can be very difficult to do. We did it ourselves,
Yeah.
And it's something that can be hard to manage initially. Yeah.
This episode is sponsored by Elav Skincare. Elav is an Irish skincare brand whose sensitive skincare story started in 1934, so there's over 90 years of skincare expertise behind everything they do. It was founded in Ireland by the Gardner family apothecary, and 4 generations of the Gardner family have helped people with anything from minor irritation to sensitive and reactive skin types, which are conditions I come across all the time as a pharmacist, and something that I know so many of you are navigating too. Today, their award-winning skincare innovations are at the forefront of dermatology, free from sulfates, alcohol, perfume, and artificial colours, ensuring that they leave in what's suitable for all skin types, which is why for years I've been happy to recommend their products to both my patients and my community alike. With Elav products, you give your skin what it needs and not what it doesn't. You can explore the full range at elavskincare.com and in retailers nationwide. And as a listener of the Wellness Script podcast, you can use the code WELLNESS for 20% off online.
And because we've spoken about, like the mother's role and stuff, do you think that there's maybe not as much focus on the father's role in that, or?
Yeah, no, you're right. It is. The role of the father obviously is significant and huge, and oftentimes it can get sidelined, I guess. We know now that fathers can suffer from postnatal depression, postnatal anxiety. They're not as vocal about it as their partner might be. And I think we need to be more mindful of the father's role in, raising the baby, supporting the mom. Because I mean, a lot of the caregiving, especially in the initial phase, is predominantly done by mom, and that's just nature and biology. And sometimes dads may feel that they are useless, but it's far from it. They can have so many other roles in making sure that the environment is ideal for mom and baby, and that they can support. And I'll give you a good, I guess, anecdote. There was a study done recently looking at the influence of the partner, be it a man, woman, or whatever, but predominantly it was a father, on the baby's microbiome by a year of age.
Okay.
So we know that the microbiome, especially over the first few months, is shaped by so many different things. The biggest impact actually in the first 6 months is not the mode of delivery, like a lot of people would make you believe, but it's feeding.
Okay.
And after 6 months, again, it remains feeding. So if you, even if you had a cesarean section and only formula fed, by 6 months, the difference in that baby's microbiome to a baby that was vaginally delivered and breastfed is not that big.
Oh, wow. Okay.
And the reason for that is it's multifactorial, right? You get it from everything, but I digress. But by a year of age, the microbiome contribution from the father is almost as big as that of the mother.
Oh, wow.
And it is complementary. So it doesn't overlap. So the dad can provide their own unique microbiome contribution.
Non-competitively kind of.
Yes.
Yeah, okay.
To the baby.
Wow.
Which is something great, even knowing that, saying, you can actually shape your baby's microbiome by just being a dad is great.
Just through regular dad activities. Yeah, okay. God, that's amazing. And that influences the health of the baby.
Exactly,
so the more influence and more present the father is.
Yeah.
It's additive.
Yeah.
That's so interesting. Because I think that it's important to, I suppose, identify that. As you said, it can feel like maybe spare, or like you're not a part of that side of things. I think that as well, it affects the relationship, the parental relationship. Like, I'm sure that you see, as you said, 90% is communication to the parents. You see the impact that becoming a new parent has on a relationship.
Yes.
In those the fourth trimester.
Yeah. And we've had a lot of great guests on the podcast that talked about, the communication piece early on. And sometimes that can fall by the wayside. And even speaking from personal experience, I don't think we communicated as well to each other when we were in the trenches with 2 very young kids in Canada on our own with no extended family to help. Sometimes it can be very difficult. And, communication is not there to try and solve a problem, but it's even acknowledging that somebody had a difficult day and listening for a while is helpful. A lot of moms talk about feeling touched out, and the partner or the husband may be gone all day and coming in looking for a hug, but that's the last thing the mom wants, and then the partner may feel rejected, whereas in reality the mom just has had toddlers jumping all over her. She just needs a minute. But even articulating that to your partner, saying, look, I don't want to be touched, this is why. It's nothing to do with you. Take the kids and we can chat about it later. So communication, I think, is key to try and help navigate this very difficult time.
Yeah. And supporting, I think, as well, right? Like actually sharing the load and
but even the word sharing the load can be loaded, pardon the pun. Because I think we also need to acknowledge that the load cannot be shared equally.
Sure.
All the time, right? Some partner may give 20%, the other 80%. And then the roles may reverse down the line when the situation changes. But I think even acknowledging that and having an open conversation about that, even almost on a daily basis, I might say, look, I've only got 20%. I can't do all of this. Will you take this over? I need time. Just being even able to say that and have that conversation and acknowledging that when you share the load, it's not going to be in equal parts. It's almost never 50-50, right? It's going to change around that depending on the situation.
Yeah, I think that makes a lot of sense. And like for new parents, a lot of times the father will be well-meaning and want to contribute, and as you said, in those early days, it is a big focus on the mum, because that's just the way that it goes naturally. But that could change later on, and that once you're talking about it, and I like that piece around like 80-20, like that. Right now, I'm at like 4% battery.
Yes,
you know,
exactly,
I need you to be the other 96, or at least another 50%, and together we'll get through this. But
and when you're both at 20%, that's when communication is really important. Right? And to say, okay, how are we going to navigate this? Because the other person may not be able to fulfill it. And then you may have to let things go for a while. As in, okay, the clothes can stay in the corner, the dishes can stay dirty, we'll get a takeaway. And then, you know, and that's how you do it, I guess.
And I think like the fact that like basically nobody knows what they're doing is kind of like as you said, the Olympics, or as Anne says, the Olympics, like it can seem like everyone else knows what they're doing at that stage of life, or any other stage of life that people might be at, whether it's career or it's parenthood or whatever.
You stole one of my quick fire answers now. Yes, but that's okay.
Did I?
Yes,
yeah, but that's what it is like. You know, and what do you find actually does help new parents? Like, is it that they have a structured kind of a piece checking in with the say medical team? Is it the family kind of makes the biggest difference? Support around, like you had no support by your situation in Canada that time. So, what do you think are the biggest factors?
I think the biggest factors we're losing our village. Okay.
Yes.
So I don't think that a lot of parents have an extended family to help. Now some do and some don't. I think the biggest thing that help parents is maybe recognizing how variable normal is. And maybe picking one or two sources that they can trust, that they can refer to if they need additional information. Granted, that can be very tough. So I often find that not trying to fix what is normal with babies, be it feeding, sleep, or whatever, but acknowledging that normal is very variable. Normal doesn't mean easy. And acknowledging the difficulty. A lot of the time, parents actually accept that and say, okay, if this is what normal is, I can cope with this for a while because I know it will slowly get better. It is the not knowing that I think stresses most parents out, because, you know, parents are resilient, mums are resilient. And if they know that they are not messing up, which they rarely are, obviously, then I think that is a big factor in early parenting.
Yeah, I see that a lot in pharmacy, like that with colic and things like that, you know, that obviously there's like little products and stuff like that in the pharmacy that can help. And I can always, I have so much empathy, like, because I'm just like, you know, the problem isn't that they need like to buy something else or do something else. It's just, you know, this is a hard kind of period of like, without having gone through it myself, I can just see that there's more to it than
absolutely,
than patching it up. And I think like on that, on colic and crying and newborns, like how do parents know when like too much crying is too much crying? This baby's not happy.
So I mean, it can be sometimes difficult to tell a colicky baby from a baby that is very unwell, but I always bring it down to basics. Is your baby still feeding? Is the duration of crying a finite time? And that could be still 2 hours, but are they able to settle down after an extended period of crying? Are they peeing? Are they pooping? Are they gaining weight? Are they otherwise doing the other normal things that babies do? If they are very irritable, can't feed very well, or in between the crying episodes, they're lethargic, very difficult to wake up, if they're not peeing as frequently as they should be, if there's anything unusual on them, like a persistent rash, if they're breathing when they are settled, if their breathing is fast, those would be the sort of red flags that I would look at. If the baby's otherwise well in between, then that goes against anything being wrong. Any fever in a baby that is under 3 months needs to be checked out. You know, so that's very important to highlight. However, a lot of babies with sepsis don't mount a fever, so it can be difficult to figure that out as well. So when parents bring me a colicky baby, for example, my job is not to diagnose colic. My job is to rule out red flags.
Yes.
So I look at the baby. Are they gaining weight? Are they getting enough milk in a 24-hour period? Are they pooping regularly? Are they peeing regularly? Is their breathing nice and settled? They're not too stiff. They're alert. They're easy to, arouse. All of these things. Their tummy's not blown up. It's soft. They don't appear in pain in between those crying episodes. And only then can I sit down and say, okay, this is likely to be colic.
Okay.
Let's see how we manage it, So, yeah, I mean, sometimes it's hard to put the onus on the parents to figure out if the baby is well or unwell. And if they're ever worried, we never mind checking your baby out,
Yeah, that would be always what I would say as well. Like, if in doubt, and I think that there kind of is a gut instinct as well, even for first-time parents, isn't there?
Yes.
I know you've only met this child a couple of weeks or whatever they've come into the world, but kind of know, isn't it? Like, when you trust your gut instinct that to go in, and better to be sent home
exactly
with nothing wrong, kind of thing. Yeah, that's kind of how I would always approach it for people. And then when it comes to like the looking after yourself, like you mentioned, people coming in bringing colicky babies, people bring in babies that are in much worse condition than that as well. Like how do you protect your own well-being, whether it's burnout from like when during the more intense periods of work, but also even just after one more difficult shift period? How do you kind of look after yourself?
I guess I'm good at compartmentalizing that part, not in a way that you kind of push it deep down and not deal with it, but I try and leave that stuff
behind
at work, and then deal with it in the appropriate way if I need to. So, but you're right. I find art is a really good creative outlet for that. I recently took up stand-up comedy as well, and that's really good at.
I saw that. That's really cool.
So it's a great way of actually, dealing with a lot of things. Of course, I never talk about anything specific to do with work, but even just having that outlet of creativity helps, a lot. So they're the kind of main things that I do to, cope with this. And, I've come to the realization that, yes, bad things are going to happen to babies. We're not in control of that. But what we are in control of is how we react to it and how we communicate with parents.
Yeah.
And if those two things go well, even if the outcome for the baby isn't ideal, I feel that I've done my job, and accepting that things are never going to always be perfect.
Hey, if you're loving this episode, do me a favor and click subscribe. It helps the podcast grow and helps me to keep bringing you conversations like this one. Back to the episode.
Yeah, I think because that's like, I think for anyone who's in a caring kind of profession, like it can be, and that could extend to lots of different roles. Like I think it can be quite heavy, like coming home and, kind of like you do think about your patients after the fact.
We do, and it's not like we don't. Especially when Anne and I work in the same hospital, and sometimes she may be dealing with the sick mom, I'm dealing with the sick baby of that mom, and obviously sometimes we chat about it at work, at home, it can be difficult. But again, there are ways of just moving on.
Yeah. Is that something you had to learn over the years? Did you?
I think so. Yeah.
Because even like when I first qualified as a pharmacist and stuff, like I could hardly sleep at night. I nearly go through every person I saw in my head afterwards, and kind of think about, did I give them the right advice? And did I, kind of worry about things. But yeah, I think that, in one sense, it's nice to know that your healthcare professional does care about you as a person, but then also, in order for that healthcare professional to come to work and to be able to deal with what could be a very stressful situation in a calm manner, so they can make the best clinical decision, like you have to be able to switch it to not be personally involved in the
Absolutely,
emotion of it. Yeah. So it's definitely a skill that has to be
It is, and sometimes you can get caught up,
Yeah.
and there are certain cases that stay with me, and you don't forget for various reasons. So that can happen as well,
Yeah, but I suppose that's kind of the reason. There'll be good versions of that too, where
exactly.
that's why you do the
Yeah.
work that you do. I think that that's probably that. Maybe it's not something that can be taught, but it's also not something that's particularly focused on when you're studying.
Yeah.
Is like how you might kind of take things home with you, and kind of dealing with that. But yeah, the biggest thing I see in parents and in the pharmacy situation is, I think, the confidence piece, trusting themselves, and trying to figure out if they're doing the quote unquote right thing. Do you think that social media is playing a big role in how parents are?
Oh, hugely.
Yeah.
And I really feel for parents in this generation, because there is a lot of information. Unfortunately, a lot of it is misinformation and disinformation. So we live in an era where you can get access to so much in terms of information, bits of advice, often contrasting, and knowing what to take on board and what to ignore can be very difficult. I mean, even with me, my daughter's 18 now, so she was born at the same year as the first iPhone was released. And back then, we didn't have all of those social media platforms, talking about parenting, giving you information. So you were stuck with what was available to you at the time, talking to your doctor, your family, maybe reading a book or whatever, but you weren't bombarded from every angle. And that has changed significantly. And I think parents nowadays need a very different skill set to try and filter out what is bad advice and take advice that works for them in their particular situation. And that can be very difficult.
And do you see people coming to you having learned something online that they've implemented that's done harm, or
thankfully very rarely, but certainly they have they have done things that had the potential to cause harm, and that happens very frequently, unfortunately.
And then another thing that's come up in the kind of, and I've seen you speaking about it as well, Afif, is the movement towards home birth and natural birth, and how that kind of narrative is propagating online. Like, what are your thoughts on that? And like,
my thoughts are women are obviously entitled to make whatever choices they wish to make in terms of their pregnancy and their delivery, but it has to be done in an informed way. And there is a lot of misinformation out there, and some people with agendas about home birth. Home birth is a perfectly safe and viable way of delivering your baby. It should be made more available to women that are, when the situation is appropriate. So it's not readily available, but there is a lot of information out there that is missing. Up until recently, home birth is often pitched as safer than hospital birth and things like that. But when you dig into the nuance, what do you mean by safer? Yes, we know that it's associated with much higher breastfeeding rates, much less intervention, much less cesarean section. So obviously, on the surface, it's a very attractive option. However, you can never compare that to women that have a hospital birth, because they tend to have other risk factors that may lead to all of those interventions. Now, granted, the rates of intervention in hospitals are rising all the time. The other big piece that was missing from all of the data that relates to home birth is what happens to moms that start their labor at home, but something happens necessitating their transfer to hospital. And up until recently, we had no Irish data on that. And now it transpires that they don't do very well.
We know that now.
We know that now. So if something happens at home, having readily accessible healthcare is a must. And no distance away from hospital is safe if there's an emergency at home, you know, and that is the problem. That's the issue I have, is the misinformation rather than it being available as an option for mums.
Yeah, and I heard you speaking about it, and I thought it was really interesting. You said you didn't say a low risk pregnancy, you said a normal risk pregnancy.
So Anne would say that.
Sorry.
Anne would say there's no such thing as a low risk pregnancy. There's a normal risk pregnancy and a high risk pregnancy. And in fact, there's been a recent study showing that even that is almost a retrospective diagnosis after everything has happened, because
you can only say it was low risk after the fact.
It can be really hard to assign risk. There are features that would deem a mother to have a lower chance of something going wrong, but sometimes things can happen when there are no risk factors at all, and it's impossible to predict, you know, when that can happen.
And I also, it's interesting you said, like, about, this is something I see coming up so often with whether it's supplements or medications, you know, obviously big pharma and like all this kind of messaging around that. And you said when about home birthing and there being an agenda, I always think it's interesting when an alternative to modern medicine is offered, because with the argument being, oh, like, I don't want to buy into big pharma. Well, you're buying into something alternative with an agenda or a, you know, commercial aspect to it sometimes, you know.
And I mean, again, there's always this push that nature, all things natural are good. Well, appendicitis is natural, you know. Death is natural. And it's just equating that word as a brand of something is not always wise, you know. And like I said, home birth is part of modern medicine. I think we need to state that clearly. If it's done right, with good access, good integration with healthcare, and at the moment that is lacking.
It's like a collaboration or rather than a refusal or a complete separation of the two.
Absolutely.
Okay, so it can be an option for people, but only when it's correctly been assessed, kind of. I think that's really important distinction to make, and obviously saves lives, which is, you know, we have to kind of recognize that as well. It's something that I see across in pharmacy, you know, when people get different diagnoses, and there's a straightforward low risk modern medicine therapeutic option. Let's say it's thyroid, you know, hypothyroid or something, and there's a very straightforward solution there, which is to supplement the thyroid hormone. And people might know that they've been diagnosed and ask me for an obscure supplement that I have no knowledge on, to be quite honest. I haven't come across, or I have come across and I don't think there's any evidence for.
They may have more weird stuff than the actual thyroxine, you know?
Exactly. You know, alternatives and like diabetes, cancer care, and it just concerns me so much, the messaging around that, and the fact that, you know, there's a feeling that they're going against, you know, what's maybe a big industry, when actually there's so much science and there's so much research, and it just upsets me. But I think that's what resonated with me when I saw you speaking about the home birth piece, is that, you know, there's an alternative, but who's benefiting from the alternative? But then also, what is driving that messaging is the interesting piece, right?
And you know, the funny thing about this thing is, people always say, "Oh, you're part of the big pharma conspiracy," and
that's what
and sometimes I have to go, it makes zero financial effect on me whether you take the vaccine or not. I will still get paid the same.
Yeah, exactly.
You know,
that's the thing.
So it makes no difference to me. In fact, you could argue that if you don't give the vaccine and your kid gets sick, I'll get more business. Right? And I'm advocating against that. Whereas the other side will gain financially if you go to them for all the herbal, holistic woo-woo stuff. So that's the argument that I just don't buy, that we're doing this for the money. We're not. No. We're getting paid the same. We're honestly doing it for health advocacy.
100%. That's it, exactly. It's totally that way. I remember working when I was in college studying pharmacy. I was working on the front counter, and the lady asked about the flu vaccine for is safe in pregnancy, and the pharmacist at the time said it was. So it's recommended, helps the baby, gives you protection, and then when the baby's born, it gives them a bit of protection as well. And then she was just leaving. She's like, okay, no worries, but if anything goes wrong, it's on you, or something like that. And he said, if anything goes wrong, I can't control for all factors in your entire pregnancy. But he was like, you don't have to, obviously, but I'm just giving you the information as to how it
And that's why I'm actually careful. I never tell people whether they should take or shouldn't take something.
Exactly.
I just outline the risks of taking it and the risks of not taking it. And it's up to them to make the informed decision.
Exactly that. That's what he said. He's like, I'm not telling you, I'm not putting the needle in your arm here and now. It's just take the leaflet, learn the information and make the decision for yourself. But make the decision based on the right information, not the wrong information. I think that's really important to recognize. But yeah, I think in terms of like your wellness journey, you touched on a little bit, that you're able to compartmentalize from a mental standpoint, and then in terms of like your physical well-being, are there things that help you as well? Like, do you?
I love going to the gym. I hate running.
Okay.
So I do that. I do running occasionally, but I like going on the treadmill. I lift weights, and and again, I'm at a phase right now where I'm struggling to get to the gym for more than 2 or 3 times a day, whereas a year ago I was going 5 times, maybe 6 times. And that used to upset me before, but now I'm just just accepting it. I think like it can be counterproductive when we start to be like, oh, like I'm not doing well enough in terms of my wellness because I'm not doing this. And I feel like I'm close to 30, and there's this joke or trend online that you're 30 when you're signing up for a marathon or something like this. Oh, you're making me feel really old. You're only a baby now,
but like that there's this like everybody's signing up for marathons, or everybody's doing a fitness challenge.
I can't understand the extreme sports. This high rocks thing that everybody's doing.
I did
the marathons, and it's just like
I did one at the start of May, and like in my cousin was doing it, and we signed up together to do it as doubles, and it was really fun. And I really enjoyed doing it together with her. But like I at the same time, I was like, that's like the hardest physical challenge I've ever done. And like I don't know how it's so casually like ingrained in our culture. It was so physically demanding, and I've been going to the gym for 6-7 years, whatever. I'd consider myself quite fit, but it really pushed me to my limits. And now since then, that was the start of May. Now it's it's 3 weeks on, and only now I kind of feel like a normal person again.
Well, there you go.
Like
I know.
I don't know if it's always the best thing for our wellness. Like
for sure.
I had an injury before from running, which I do only short distances now. But the physio that I went to at the time, he said, you know what, Lauren, not everyone's made for long distances. It's like,
and that's a fair statement, I guess.
It's like, thank you for relieving me of this pressure that I feel.
There you go.
To keep going. But I think that it's important to find something, no matter what your career path. And I think that's why it's so interested in like what you find helps your wellness, because you have such an intense career that's gone through different phases, and also that for parents in particular, that it doesn't. You don't have to get everything 100% all the time. And if one thing has faltered, whether it's sleep or something else, you can pick up other things that might help.
No, absolutely.
Whether it's nutrition or anything else. But I think that if anyone's looking to find you, the Baby Tribe, of course, podcast.
Yes, Baby Tribe podcast,
I'm a massive fan. I think that whether you're a parent or not a parent, that it's super interesting to just learn from the different journeys that people go on, and I think it's great to know, like, we all have people in our lives who are parents, or it's great to know the journey that they're going on as well, and even look into the future. For myself, I learn a lot from that too. So
well, thank you
for the work that you and Anne do. It's absolutely amazing. So I'll leave all the links below to Afif's channels and art, of course, definitely, which I think is beautiful. So thank you so much for joining me today, Afif.
Oh, delighted. It was a pleasure.
Thank you so much for listening to the Wellness Script podcast. I hope that if you've listened this far that you really enjoyed today's conversation. And I hope that you subscribe or follow wherever you get your podcasts so that you never miss another episode. It really helps the show to grow and make sure that we can continue to have these fabulous conversations about your health and wellness. And don't forget that you can download your free episode guide at wellnessscriptpod.com, where we've pulled together the key takeaways, practical tips, and important points from today's conversation, so that you can come back to them whenever you need. Until next time, take care of yourself, and I'll see you in the next episode.